book. Okay, so here we go. When we look at cancer, we have a bunch of different cancers. I kind of put some numbers by all the cancers, and then I went and I put some little extra marks that I normally don't put on the board. It would behoove you to kind of, make sure you know what I wrote here. It's like a big deal, this outline. The outline for the cancer is kind of weird. Somehow it ended up on the back and the front, but that's okay. A lot of stuff is the same here, so that's a good thing. So the outline is similar to the one in here. It's not perfect. And remember who made these outlines, because it's kind of comical. The people who made the person who made the outline was really the students from what they thought was on the board. So there's misspelled words all through there. Not because I did it misspelled up here, but because when they translated it to their notes, it was misspelled. So it was their idea to give you guys an outline. And I thought that was very sweet, but by the same token, I did not misspell words and then throw it out as a publication. So it's very helpful though to you guys, I think. Because what I tell you is when you get together and you do your study groups, this is what you study off of, fair enough? The outline, okay. All right, so now when we look at tumor lysis syndrome and we look at elevated temp and immunosuppressed and cancer and all this kind of stuff, those are your red words. We're gonna do those very instant, oh my God. Cancer risk factors are what we're gonna do now. When you look at cancer risk factors, I want you to put them the way I did, and I want you to write them differently. Go down the front of your packet and put 10 modifiable risk factors. 10 modifiable risk factors. 10 modifiable risk factors of cancer. When I say the words modifiable, keep in mind this means lifestyle changes. Okay, so let's roll. Diet. I can tell you that a diet high in fat, low in fiber, is a risk factor. So that's why you have to be careful, beloved, because right now we are in the midst of fad diet number 4,281, called a ketogenic diet. And the ketogenic diet is wonderful for rapid weight loss. May not be so wonderful for cancer. We don't know yet. It's a fad, right? So it has a lot of evidence behind it for various different things. But I can tell you this. You had to know that a ketogenic diet is very low in carbs. We're talking 20% of the daily intake is a carbohydrate. Maybe even 10%. It's very low carbs. Very high fat. That cannot necessarily be a great thing long term, so I'm keeping my objective ears out to see how it goes. I believe, and of course I could be very wrong, but I believe that this ketogenic diet is wonderful short term, probably not the best long term. Because why? Well, people don't look at the low carbs, high fat, and make high fat wise decisions, like throwing olives on a salad. No, they throw bacon and ham and pork chops because it fits the diet, right? Mm-hmm. That's true. Red meat, all this bullshit. No, that wasn't the way it was supposed to be done. So we got to be careful when we say, oh yeah, the ketogenic diet is great, until we know, because I got a news flash for you. We have someone that was trying to do the ketogenic diet in this class and damn near had a stroke. Because when you do ketogenic diet without the supervision of your doctor, and you already have hypertension, and you already have cardiac blockage, and you already are BMI greater than 50, you are a time bomb waiting to explode. Because what do we know about ketogenic diet? It's saturated fats, it's high sodium, it's all this. Okay, so just be careful with your little diets. So again, the diet that matches cancer is high fat, especially saturated, and low fiber. So you know better. You know you need fiber to get rid of toxins out of the body and go to the bathroom. Okay, so that's diet. Number 2, smoking. I ain't even gotta talk about that. Why I gotta sit up here and tell you about some damn smoking? You already know smoking decreases your immune system. It also vasoconstricts, so it decreases blood flow to tissue. You already know that. It also activates platelets, puts you at higher risk for clots. I could go on, but I won't because you already know this. Next, alcohol. When you were 12 years old and you took your first drink, some of you were 15, others 17, late bloomers were 21. But when you took that first drink, it burned your throat. It still does. But now you're a lush and you don't care. You drink anyway. I'm not mad at you for drinking. I'm just trying to remind you that the burning that you felt when you first took your first drink is still there. It still burns tissue. And that's okay occasionally because burned tissue heals. But if you keep throwing them back and binging, you burned a lot of tissue really fast. Or if you drink every single day, 2-3 times a day, you're burning tissue regularly. And that's where laryngeal and pharyngeal and stomach and esophageal cancers come from, burned tissue. I need my people to realize that all this crap you hear, Tuesday wine is good, Thursday Hennessy is fine, on Wednesday pot with Hennessy is cool. What the fuck? Are you serious? Okay, so let's just use some common sense about this, okay? Here's what we know about alcohol. Less than 3 a week is considered okay. Less than 3 drinks a week is okay. When you're doing that everyday thing and 6 on the weekend, because you saved all yours up for Friday, you're going to have a problem. Binge drinking will tear that pancreas up. Careful, people. All right, babies. Next on the lineup is obesity. Now, obesity is BMI. Let's talk some BMI. You've been hearing me say BMI. So here we go. A BMI normal is somewhere between 19 and 24. I have not met that person, and I'm not that person. Y'all pray for me. I'd like to be that person, but I ain't met that one. The typical BMI that I see, that you and me look at, and by the way, if you look around you, you got one freaking person that matches this BMI. Where the little mama at? There she go. Maybe this baby. Where the little tiny thing at? There she goes. She tiny thing. Big mama, little mama, and tiny thing. They're the only people in the damn room to match that bullshit. Everybody else is normal for us. But this is supposed to be normal. Whatever. But everybody else, join me in my 25 to 29 self. That's considered overweight. Fuck you. I don't care. I feel really good where I am right now. So fuck you. So BMI of 25 to 29 is considered overweight. Huh? What's obese, everybody? 30. BMI greater than 30. So if you're BMI greater than 30, you're considered obese. And what is so important about this one is that fat cells store estrogen. So obesity in a female is going to give her cancer really fast. What kind of cancers are related to obesity in the female? All the gynecological cancers. Ovarian, endometrial, which is another name for uterine, breast, and then we can add colon cancer, we can add pancreatic cancer. If we're a guy, we can throw that prostate in there, almost all of them. Almost everything on my board is related to obesity. Particularly for women, because estrogen is stored in fat cells and estrogen makes all cancers grow. So if you fluffy, right after you pass your test, get your life together. Now, we don't like you to do anything before you pass your test. We want you to keep on smoking pot, doing your cocaine, eating your Krispy Kremes, and doing you, because why? No major changes before the test. You might blow the test up, or you might go on there acting crazy and all irritable and can't even see straight. No, keep smoking your shit, keep drinking, go ahead, take your cocaine, do whatever you gotta do to get through the test. And we're gonna clean you up right after the test is over, okay? You come out of the test as a nurse, you go, okay, I gotta get my shit together. I gotta lose the weight, I gotta stop the smoking, because what are you gonna be in front of your patient? A hypocrite. You're going to be in a room talking about, now listen, baby, I need you to stop all this here smoking. It's directly related to cancer. You've had a scare. And they're going to be like, this bitch, she smell like a cigarette. She's so full of shit. She's like a cigarette. And you do, because you just came from break telling her to stop. Okay, or you 2 tons of fun, and you talking about, now listen, I want you to lose 40 pounds, and she's like, and you 400. You know what I mean? Like, it really makes sense. So, get your shit together, folks. Okay, now, so it's okay, you're gonna be okay, but you just do it after the test. Right now, grind. Don't worry about your little habits. I had a Krispy Kreme bad habit. I ain't had no problem with that Krispy Kreme habit until I passed my test and let some stuff go. Now, number 5 is sun exposure. This is one of the fastest growing cancers in America, skin cancer. It is blowing everyone's mind how many African Americans are also getting it, because there's some little misconception out there that blacks don't get it, and my patient died from it at 27. So yeah, they do get it. I had precancerous lesions on my mouth, but they froze off. And it was only on this side where I sit in my car and the sun hits this part of my face. So I was like hard-headed about the sunscreen, because I don't know if you've ever seen like lip balm sunscreen, but you might as well just pick up some chalk and put it all over your face, because that's how harsh it is to your lip. Oh. So I'm like, okay, me and chalk gonna get up close and personal, because I'm not trying to go and do that ever again with the cryotherapy. So I was scared straight. I'm like, okay, lip balm sunscreen, here we go. Because I have the freckles, right? What do we know about skin cancer? Freckles, blonde hair, redder skin tone. So you may see red skin every now and then when I'm flushed. But I mean, really, this is not something we thought about with African Americans. And so it's not just our Caucasian sweetie pies, is also the African American. So the freckles is the key. If you've got freckles, you're at risk. If you have red, blonde, or red or blonde hair, you're at risk. Blue or green eyes, you're at risk, you know. Okay, so think about that. Sun exposure, fastest growing cancer, skin. Okay. Another modifiable risk, which means you can change your shit, is sedentary lifestyle. Get off the couch. Stop driving around Walmart for a half an hour looking for a parking spot by the door. Stop driving to the mailbox at the end of the drive to check it. Stop driving over across the street to the neighbor's house for the football party. Cut it out. Stop taking the elevator to 2. You hear me fuss all the time. Bike lanes in Ohio are a joke. Ain't nobody ever in them. But if you go to Washington, you go to Seattle, Washington, you go to Oregon, you go to California, everybody rides, everyone. If you go to France, you go to England, they all ride. People walk and ride this nonsense where you're driving every single place you can. I was in Akron, so she says, oh, the dollar store is if you turn left, if you go on this drive and turn left. I said, well, can I walk? She said, you want to walk? I'm like, yeah, I kind of do. And she's like, oh, well, yeah, I guess you can. And it was like foreign, like I was cussing, So, yeah, I need you to know. Walking's not a cuss word. Okay, so we need to get up, okay? Now, what are we getting up to? Well, we're not going to get up and suddenly run the 26-mile marathon. No, we're going to get up and walk. Start off slow. Start off slow, y'all. Don't be just conquering the whole marathon. Nope, just walk. How much should you walk every day? What happens when you walk? Weight-bearing exercise builds your strength. And it dilates your vessels, and it puts more blood circulating around your body. It's important to move. When you move, so does blood. Blood really gives all of your body parts nutrition, oxygen. Okay, baby, so you already knew that shit. Inadequate sleep. Wait, that'll be all of us. Mm-hmm. Every one of you pumpkin poodles are gonna work a shift, some kind of fucked up shift. 312s. I heard, and I hope I'm wrong, that a local hospital won't even let you do straight shifts. You have to rotate. When I heard that, I about threw up, because they're a major employer. They literally said to my student, no, that'll never be an option. You have to rotate shifts. It's the rotating of the shifts that fucks your body up. It's the rotating of the shifts that just jacks you up. Okay, so what we know, and this is always hard for you to understand because all you hear about is lose weight, eat the right things. No, actually sleep is probably more important than all that shit. So here's what happens when you go to sleep. Let's just do our circadian rhythm, shall we? When it becomes morning and it's pretty outside, something called cortisol is increased. Cortisol Your adrenals produce adrenaline. Your body produces serotonin. So 3 chemicals I just threw at you. Cortisol, serotonin, and adrenaline in the morning. It's a beautiful thing. Why are those a beautiful thing in the morning? Because now you have energy, you're feeling good. Remember, serotonin was a feel-good hormone in psych? And then you've got your little adrenaline, so you've got that energy thing jumping. And then you've got your cortisol, so you've got a little blood sugar to get your morning going. So those are great. When it's daylight outside, it's a beautiful thing. In fact, it's going to get you through your morning routine to work through rush hour and ready to roll, because by the time lunchtime rolls around, now your metabolism is up. This is your circadian rhythm. Your metabolism is up. You are very energetic. Everything is really cool. You feel hungry, and that's a good thing because this is a good time to eat a big meal. That's why I eat between 11 and 7 only. So you're feeling really good. This is a time to devour a big meal. But watch what you devour, because if you devour everything with sugar, you're going to crash. Okay? So now that's the way it's supposed to go with your circadian rhythm. Right, guys?
Yes.
Okay, now what's supposed to happen late afternoon? Let's say 4, 5, 6 o'clock. Melatonin is going to kick in. The more the sun goes down and the moon rises, right? Or you see it anyway, you're going to produce melatonin, which is a sleep hormone. Melatonin decreases cortisol, which is a good plan, because you cannot continue to let cortisol be too high. And when you don't go to sleep at a normal time, like 10 or 11, cortisol is going to come back and be high. Well, that sucks, because if you remember anything about cortisol, it's a steroid. Steroids, in this case, cortisol, raises blood sugar, blood pressure, water, and sodium retention. So now your BMI is high. And that happens all over again if you don't go to bed by 10 or 11. Because your circadian rhythm directly works around the Earth's revolution around the sun. Now, if you continue to have cortisol levels that are high, then your blood sugar will continue to be high. Did I mention cancer likes sugar?
Yes.
Your blood pressure will continue to be high. Because why? You know why. Cortisol raises blood pressure. Steroids raise your blood pressure. It was supposed to be high in the morning, and that was actually okay, because it comes down as each waking hour becomes a sleeping hour. In fact, we know that while you're asleep, your blood pressure is the lowest. You remember that in school, blood pressure at rest? Yeah, it's supposed to be low. That's why all heart attacks occur in the early morning, because cortisol is going to come back. When a normal person sleeps in the middle of the night, cortisol comes back at 5 a.m. And that's exactly when heart attacks occur, because it raises your blood pressure. But as long as you're resting and healthy, your blood pressure is supposed to come down. So what happens if you go all day and all night with high blood pressure? Crazy stuff like hypertension and CHF and CVA and MI, none of which would help any cancer patient. But of course, we're not in the cardiovascular lecture, so we'll continue. The other thing that you have to know about steroids is it decreases your immune response. That matters with cancer. So cortisol decreases your immune response. You knew that, because if you give a patient steroids, it's going to make them at risk for infection. Well, cancer thrives on a low immune system. Cancer thrives on a low immune system. That's why cigarette smoking goes with cancer, because cigarettes also decrease your immune system. So far, so good? Sleep matters more than you'll ever know. Okay, sleep matters. So this is why I tell a lot of you little pumpkin poodles the other day, I told you, as a nurse, don't work more than 2 years inpatient. 2 to 3 years, you ought to have a plan, a big old vision, a goal to get somewhere and get somewhere faster than that rotating shift job you call yourself having. And that's why many of you go back for your nurse practitioners, your CRNA. You get to own your companies. You do a lot more than just sit there wherever for the next God knows how long. Because you can't do this shit forever. It's going to cause breast cancer. You didn't know that? Nurses have the highest risk of breast cancer of all occupations because of rotating shifts. Nurses have the highest rate of breast cancer because of rotating shifts.